Now I am.
Hi, I'm Ashley from Concern Employee Assistance Program, and I'm one of the counselors over there. I was asked to come over and talk about how to effectively communicate. So we're going to talk about effective communication today. This training is going to be about an hour long, and the goals of the training are to simply increase your awareness around the actual process of communication. Everybody knows that we communicate, but there's so much more than just the words that we express, share, or hear from other people, and we're going to learn a little bit more about that. My goal is to also increase your own awareness about how you communicate. What communication styles do you engage in, or what things do you notice of other people? We're also going to talk about poor communication, how ineffective communication can lead to conflict, misunderstanding, how that can disrupt your ability to do your job, how it can negatively affect patient care, and why that, is obviously something that we need to address. And finally, we're going to learn how to effectively communicate, how to develop those skills. We're going to go through some different methods, examples, and things like that to talk about it. So just getting started, communication, as I said before, is something that we realize is an exchange of words or an exchange of information. But there's so much more than just that exchange. It's how we say it, and it's what we use to say it, and it's also what we're not saying. That's also part of communication. So it's not just me standing and talking, but it's my body language, it's our environment, what's going on around us, the distractions, the stressors, the other things that we have to manage at that time in order to make sure that we're getting our message across. So this process involves not just the person sending the information, but the person receiving it. And even though you may not be involved in projecting the information, your participation as the receiver is just as important in this process as the person sending the information. I was going to show the empathy video, but most of us have seen it. It's a great video, and I've watched it many times, and every time it gets me. What are some of the things that you remember from the empathy video? Who saw it?
There was no speaking.
Mm-hmm. Do you want me to try and pull it up on the screen so we can watch it? Would that be okay? Would that be helpful? Okay, let's try and do that. It's just a couple of minutes. what I love about that video, I think most of all, is that it's not just about the patients, but they also take it from an employee's perspective too. Because a lot of times when we're here at work, it is a lot about patients first. You know, we're caregivers. We're here to take care of other people. And at times, it's almost forgotten that we're people too. And we also need to be taken care of. What stands out for you about that video as how it relates to communication? Why do you think I tied that in with communication?
Because communication isn't always spoken. I mean, look at the body language, but you can't tell, not necessarily on all of those, where they're coming from.
What else about empathy? And that's a really great point, is, you know, what they're not saying, but also what else about empathy do you think is important for communication?
Knowing what to, my first thought was knowing what to say and how to say it, or more so how to say something to effectively communicate with the other person.
How to break through the emotional barriers that they may be putting up right now, or the emotional filters that they have up. And, you know, I find that empathizing with somebody, or for somebody rather, is important for communication, because then you realize if they're presenting in a way that may be negative or that may be extra chipper, it may not have anything to do with you, and that's okay. But trying to understand, okay, what's going on with you, and being curious about what you're seeing and what you're hearing, or what you're not seeing and what you're not hearing, and maybe taking a step back and wondering what's going on with them. That can really change the tone of a conversation. And when we engage in empathy, it also helps the person feel validated and respected. But also, I mean, you saw when that one scene where they get on the elevator and the man standing there, his wife had the stroke, and the other woman standing there, and she's, you know, very cold and withdrawn, and she recently divorced, and the guy gets on and he's like trying to contain his excitement. And so just think about how you would feel if you were each person. The guy that's trying to contain his excitement, and these two people are like sad. I don't know what they're sad about. Like, and so just the difference in what our own experiences are and how we bring those to our conversations. The other one that I really like is, you know, not that I like it, but I think it's a good example, the woman sitting in the room and she doesn't understand what the doctor's saying, or the other woman who's too shocked to really comprehend what's being said to her. I think that is extremely relevant to your job and what you guys do. And again, it's not just patient to employee, it can be employee to employee. And so just understanding that. But empathy can definitely help us understand the message that is being relayed between the two people. So this is a horrible visual about communication, and it's just showing that, yes, there's a person that's initiating or sending the information, and then there's a person that's receiving it. But there's so much more that goes into it. You know, is the phone ringing? Is there a code going off overhead? You know, is it 5 minutes before your shift is over? You know, all of these other things are kind of the feedback that get in the way. You know, when you like tap on the microphone and you hear that feedback, that's kind of what's getting in the way of your ability to effectively communicate. So this is just helping you become aware that, yeah, these things are important to understand because they do get in the way. So the sender is a person who's relaying the information or initiating the conversation. We have to understand, who's our audience? Who am I speaking to? Am I speaking to a young person who's never been into a hospital by themselves before? Or am I speaking to an elderly person who's really hard of hearing? Am I speaking with somebody whose second language is English? So being aware of who my audience is can really help me prepare myself for how I'm going to say what I need to inform them of. And how I'm sending the information. You know, am I standing over my computer typing and, you know, not really paying attention? What's my body language saying? Or what's my tone of voice? If I am really tired, you know, I'm a morning person, so in the morning I can come in and boom, have a conversation. Somebody may need their cup of coffee or third cup of coffee to really get going in the morning, and that's okay. But being aware of that and understanding that we're all different can really also help with communication. And that just goes along with situational, and as I already started to mention, the cultural context. If a patient comes in and maybe it's a couple, and they're of Indian descent, and maybe you don't speak to the wife, you speak to the husband. And being aware that that's just a difference, and if the wife doesn't respond to you, it's not that she's being rude or disrespectful, maybe that's just not her place. And understanding that there may be something else going on other than what you're initially interpreting the situation to be. So dealing with conflict in the workplace. What sources of conflict or struggles or stressors do you experience here at work that affect your ability to communicate? Or that communication, or poor communication, kind of makes bigger or magnifies?
I think the biggest thing is the between shifts communication. Let me know what's going on. That really affects things. You have somebody that just leaves and doesn't tell you what's going on, and you're kind of guessing. It's hard. It makes it difficult.
Absolutely. That's a great one. What else? What other things get in the way of communication, or does poor communication get in the way of?
Supervisor to employee, new procedures or notes that might not be given to us that we need to know.
Absolutely. Anything else? I think you guys touched upon some of the biggest ones. Just personal conflict, personal points of view, how things should be done. I am a person who's very organized, and I get stuff done, and I have my files nicely marked and things like that. Somebody else may not operate that way, but ultimately, is the outcome or the result still the same? Is the job still getting done? And realizing that, okay, I have my way, you have your way, but ultimately we're still meeting at the end point, and that's what's most important. And allowing myself to say, okay, I know that's really annoying to me, but this is me and that is them, and that's okay. Accepting that differences can be okay. Limited resources such as staffing, or maybe only have so many carts that can go around to patient rooms, or maybe you only have so many rooms that you can take patients into, limited space, things like that. Resources get in the way. But also that last one that you kind of brought up, clear expectations being laid out, whether it's a policy or procedure or just expectations around general practice. When those are not clearly communicated, there's so much confusion and then misinterpretation or misunderstanding, and things can really, really be negatively affected by that. So some things to avoid when you're experiencing conflict in the workplace that could be related to communication. Assumed reactions. And this is my favorite lesson, life lesson that I've learned, and I believe I shared it at the stress training. I'm pretty sure I shared it at all of my trainings. But when I was in 4th grade, Mrs. Holian, I forget exactly what we were doing in class, but I remember she went up to the board and furiously wrote on the board the word assume. And she drew a line between the S and the U and the U and the M, and she turned around and she said, "Children, I don't ever want you to ever assume anything, because when you assume things, you make an ass out of you and me." And in 4th grade, a little kid, you're like, this is, it said ass. And that's all I could focus on. But now as an adult, there's a couple of things that come to mind. One, I wonder what she and her husband got into the night before, or not. And then 2, that is such a great lesson, because I can't read people's minds. I can't predict the future. And 80% of the things that we worry about never happen. So if I am curious, if I am aware that there are other possibilities out there, as opposed to assuming that I know exactly what's going on, one is going to allow me to experience a lot less stress, because I don't feel like I need to control the situation. But 2, it's going to decrease the tension within that situation, because I'm going to say, well, what's going on with you? And when you simply take a step back and ask, okay, well, what is going on? That gives the other person a chance to validate themselves. And that can go such a long way. Pretending to understand. And I'm sure you all have experienced this. Yep, okay, yep, I got it. And the person walks away and you're like, oh, wait a minute. Wait, was I supposed to do this? How many, was I supposed to do 10 draws, 12 draws? And so it happens. But if you're not sure, or if you're pressed for time, don't try and say, like, yeah, I got it. Just maybe ask for clarification, or ask, can you give me 1 second to finish what I'm doing? overreaching and underreaching. That is practicing outside of your scope or under your scope. When you say, oh yeah, I totally know how to do this, and you explain to somebody what it is, and you really, that's not your area of expertise. Or underreaching, where you're like, no, I can't do that. No, not really sure what it is. And you minimize the situation to get out of it. And that can leave some negative feelings. Long-windedness. I'm sure we all have met somebody who's very long-winded. And then paying attention to nonverbal cues. And I know that says inattention, but being aware of the behaviors that people are showing. If you're talking to somebody and they're just withdrawn and their eyes are glazed over, or they're not making eye contact with you, is everything okay? Do you understand what I'm saying? Do you need me to repeat myself? And that's okay to acknowledge that. Or if somebody is, fidgeting on their phone, or they're looking at their watch, do you have time for this right now? Are you feeling all right? Like, just simply acknowledging what they're not actually saying can help bring their awareness, and then maybe there is something else going on that you could assist them with. And then being mindful of what you're actually saying. Being civil, just common courtesy. I know a lot of times, for example, let's say you're walking in the hallway, it's early in the morning, maybe you get here at like 6:30 in the morning, so it's quiet. You walk by somebody that you know, and they don't acknowledge you. What's your first reaction?
Feel hurt.
Hurt. Or you think, what the heck? What's their problem?
Yeah.
What are they mad at me for? Maybe they got called in early and they've already been here for a couple of hours. Maybe they just got a phone call, or maybe they were up all night with a sick child. There may be so many other things going on that you don't know about. So, and even thinking about with you, if you walk in and you're tired, just simply acknowledging, a simple form of acknowledgement goes such a long way. Just a simple smile, eye contact, head nod, good morning, hey, have a nice night. Little things like that. Just, it sets a new tone, and it shows a certain level of respect. Being aware of your presence. So all of us here, we have these badges. It says caregivers. It says something on there. We all have letters after our names, whatever it is. And when we walk into a room or we approach a patient, there's a certain level of presence that can be intimidating to them. Or they have a certain expectation or standard that they believe we should be living up to. So being aware of our presence when we walk into somebody, or walk into a place, even at home, outside of work. Maybe there's a new employee and they come in and you stand over them and you're using a machine right next to them, but just maybe this proximity makes them so nervous because they're so afraid that they're gonna mess up. Or, it doesn't even have to be a new employee, maybe it's just anybody. Being aware of your presence and how that can be affecting the conversation. People have different sort of levels of acceptance when it comes to personal body space. I don't know if you've ever done an exercise as an icebreaker. I hate this one. But you stand next to somebody and you get closer and closer, and as close as you're comfortable getting before the person's like, okay, get away from me. But just simply being aware that my personal space bubble may be smaller than yours, that may be much bigger. So just, again, that physical presence. Seeing the positives. I love to try and find the positive in any situation. It makes things so much easier to deal with. And I have a couple of models. One is you get more bees with honey, and the other one is just kill them with kindness. Because I know that if I try to stay on a positive, on a lighter note, I'm gonna walk away feeling better about myself and better about the conversation, as opposed to if I engage in something negative, or if I allow myself to go to a negative place. I've already talked about assume, and don't assume that they understood you, asking for clarification at the end, and we're going to go through some more methods. Knowing when not to speak, knowing when it's okay to give the other person a chance to reply, or knowing when, I feel like I've said my piece. Do you ever find yourself talking and talking and talking because you're not getting any cues from the other person? Yes. And then you realize okay, I'm just still talking, and so maybe stopping and giving that other person a chance to say something or ask a question. Not interrupting, again, just a common courtesy, be polite, wait your turn in conversation, and gossiping. Gossiping, it serves a purpose at times. It's a societal, it's a cultural norm that we have. But when gossip turns to negative talk, that is when it can be damaging. It can be damaging to the workplace, it can be damaging to other people around you. So one thing that I always try to live by is, if the person were to hear what I'm saying right now, would I be okay with that? Would I say this to their face? Or if somebody were saying this about me, how would I feel?
Mm-hmm.
So just, again, kind of that's where that empathy piece really comes into communication. So when we experience a breakdown in communication, it can be because of simple disagreements, how things should be taken care of, who said what was said when, things like that. What do you think I mean by emotional conversations? Have you ever had an emotional conversation before?
Probably.
You mean like when you
Sure
start
what
to
it is.
cry, or you show some emotion that you normally wouldn't show somebody?
Mm-hmm.
I'm guessing.
Yes, an emotional conversation is one where the content may be getting lost because you're feeling so strongly. So, and this leads into reactive versus responsive. When we are reactive, that's an emotional reaction. If something happens and, I'm angry, if I immediately speak because I'm angry, that's a reaction. But if I take a second, check in with my emotions, okay, you know what, I'm just getting really frustrated right now, I can't handle this, I need to step away. If I'm aware of that, I can take a second to say, okay, just politely decline, politely leave the conversation, and then I'll be responsive. So there is a huge difference between emotionally reactive and then being responsive. And we can be aware of that by simply engaging in our physical body cues or being aware of them. So I know that when I start to feel stressed out, it starts in my stomach. My stomach drops out or it gets really tight, and then I can feel, my heart really pounding, and then when my ears get hot, I know that I'm like, okay, you're almost to that point where you're gonna blow it. So I know that once my ears get hot, that's my body's way of saying, take a step back, or take a breath. And so being aware of your body's physical cues can really help you be more aware of the emotions that you're experiencing. And you know this when, maybe you're walking to the grocery store and you're trying to rush through, and you walk up and you see the line of people and you're like, ugh, and you get that feeling or you have that response. And just understanding like, okay, this is frustrating, or, talking yourself through that. But again, starting with those physical cues can really be helpful in helping you respond versus react. So poor communication, it's really helpful to understand your communication style, which we're going to talk about differences. At times there are just simple personality clashes. We don't get along with everybody, and not everybody may like us. That's the first rule of thumb in counseling. I let people know after the first session, hey, I may not be a good fit for you. You may need somebody else, and I'm okay with that. And sometimes I realize, I'm not a good fit for this person. And we have a conversation about it. And it's okay to acknowledge that we're just different personalities. And then also, it may come down to poor performance. And that's an issue where I would encourage you to seek support and talk to somebody about that, somebody in management or even a coworker, on how to address that with another person. Or even talking to that person and saying, I noticed that a couple of times you left a vial out or you did this, and I'm just a little concerned that maybe you're not aware or maybe you're too busy, so if there's something I can help you with, let me know. And that's a really nice way of acknowledging the problem, but letting them know that there are solutions. And we're going to talk a little bit more about being solution focused and how that is helpful for communication. But first we need to understand our communication style. So looking at these three, does anyone jump out at you as how you typically handle a situation or communicate with other people? Do you feel that maybe you are only one? Does it vary between the situation? Are you realizing, oh, that's so-and-so. Oh, that's definitely so-and-so. That's my teenager.
I think it depends on the situation.
Mm-hmm.
I wouldn't say that me personally, I don't think that I'm aggressive usually at all, but
Mm-hmm.
passive or assertive, yeah, I could be either one depending on the situation.
Mm-hmm.
I agree with Ruthie, but I would put myself at either aggressive or assertive, depending on the situation.
Mm-hmm. And it's just, again, this is to help increase your self-awareness about how you communicate. and being aware that, yeah, you may vary between the two. Around certain people, I'm way more passive than I am around other people, and then I can get aggressive. There are certain situations when I need to be a little bit more aggressive, and certain situations when I need to be passive. But just understanding that there are different styles, and you can utilize them differently to appropriately address certain situations. But again, just with that self-awareness piece. So working through communication. So when you're talking to somebody, when you're in a situation where you get all those physical red flags, whatever it is, remain calm. Take a deep breath and breathe. Because what's one of the things that we notice about ourselves when we're stressed out? Does it ever feel like you're holding your breath? Do you ever get tightness in your chest? So that is because when we get stressed out, we do tend to hold our breath. We only breathe in about the top third of our lungs when we're under a lot of stress. So when we feel stress, taking a deep breath and utilizing more of your lung capacity actually gets more oxygen, decreases your heart rate, gets more blood flow, and it helps physiologically decrease our stress levels. So that's step 1. 2, don't engage in negative behavior. Engage in some positive self-talk. Take a second and be curious. What is going on here? What's really happening? Is this really about me? Probably not. Not everything is about us. And lead by example. And this is where, my mottos come in. I get more bees with honey. I'm just going to kill them with kindness. And, sometimes there are just very difficult people. And, in the past 2 sessions, I've heard some people share, like, yeah, there's this person on this floor, and, there's this person at this place, and they're just really difficult. So being aware that, okay, it's typically a difficult conversation, taking a second, getting yourself prepped up and, in a good place to have the conversation or to communicate with them, and then moving forward. And I like to say leading by example because you may be negative, you may start calling names, and you may start blaming people, but I'm not going to engage in that. Because once you step down to that level, communication is just out the door, and then it becomes an emotional conversation, because now it's a battle of defense mechanisms, which I'll talk about a little bit more. Practicing civility and just being polite. Understanding that, okay, it sounds like you're a little upset right now, and I apologize for that, or I apologize, I'm just having a hard time hearing you, I'm having a hard time understanding you. Just clarifying and acknowledging that the problem is existing, or acknowledging that communication isn't really effective, and addressing the issue directly. So if you're speaking with somebody and maybe they have a very thick accent, and I'm just very sorry, I'm just not understanding your accent, can you please say it one more time? And if that doesn't help, I'm just going to get somebody else on the phone, maybe they can help you. And usually that does happen on the phone, or, let me have somebody else come and speak with you, and just so we can understand you better. Once you address the issue, it really it takes responsibility. And when you take responsibility for what's happening, when it's your responsibility to take that accountability factor, the other person feels so much better. Just the same as with you. When let's say you call and you're complaining about an experience you had, or you're at a restaurant and there's hair in my food. Doesn't it make you feel better when the manager comes over and says, oh my gosh, I'm sorry that this happened, let me take care of this for you. So they've acknowledged the issue, they've accepted responsibility for it, and now their accountability is following through with making it up to you. And that makes you feel a little bit better. That helps resolve the situation. Considering the options, realizing that you only have control over yourself. And if you carry yourself positively through a negative or a difficult situation, I hope that you would feel better leaving it knowing that, I never said a bad word, I never called anybody a name, I carried myself with respect and dignity, and I maintained my integrity. I'm hoping that even though if the situation may still not be as what you'd hoped it to be, you can walk away feeling good about how you handled it. And these are just some things that I rely on in tough situations. And seeking support, whether it's here at work, talking to a coworker. I'm having such a hard time working with this person. I don't know what it is. Every time we get together, we clash. And talking to somebody else about it and hoping that they can gain new perspective or help you develop some insight around it. Seeking support at home. Sometimes you just need to go home and vent, and that's okay. Allowing yourself, maybe the first half hour just to get stuff out or whatever, and then be done with it. And then if that doesn't work, or if you're still struggling with it, seeking support from a third party. I mean, Concern, the Employee Assistance Program, free counseling available, or maybe you're involved in a church or maybe another organization that you could seek support at. It's okay. Sometimes it's actually really helpful to get it out of your head, say it out loud to another person. Have you ever thought something in your head and when you've said it out loud, you're like, that's so stupid? It happens a lot. And so sometimes it is nice just to say it out loud and bounce it off of another person. And creating respect is also important for how to effectively communicate. So asking for permission. So when I call somebody, I always announce myself. This may seem like common sense, but a lot of people, when you're stressed out, when you're really rushed at work, when you have a lot of things, when there's pressing issues going on, when you're experiencing personal stress, a lot of these things go out the door. But if you just take a second and say, hey, this is Ashley, do you have a minute? Is now a good time for you? When I say that to people, I'm showing them or telling them, I respect your time. And I understand that if you're not available for me, that is okay. And that really sets the tone for the conversation. Or at least you can hope so. Setting it in a private place or speaking in a private place. Addressing an issue with somebody in front of others. What are some of the emotions that we experience that are really difficult to manage in front of other people?
I've seen situations where I can see the person is probably humiliated to be attacked in front of other people.
Absolutely. And
I know one time I felt very uncomfortable. I was in a cafeteria, sitting there eating breakfast, and one of the cafeteria workers was given an evaluation at another table to the employee.
Yeah.
And it's like I could hear everything going on, and she was like, really, picking on her that she needs to improve on this and that. And I just kind of got my coffee and walked away because I kind of felt like, oh, I feel sorry for that girl.
And I'm imagining if you're feeling that, she must be feeling it so much worse, so much more. And so humiliation, embarrassment, hurt, and a lot of these emotions, they are very, very, what's the word, like basal. They're very deeply rooted emotions. And when we experience those, the best way that we know how to show them in the moment is through anger. And our defenses go up. And so, simply addressing or acknowledging that, is this the right environment to have this conversation? Is this the right time to have this conversation? And setting that tone, because people's defenses will go up. And I'm sure, I always picture like a little kid, when something happens, they bonk their head or they fall down, they're so embarrassed right away, and then they get so angry, they don't want, no, leave me alone, leave me alone. And it's like, that is a perfect example of an emotional reaction, an emotional conversation, if you will. Okay, this seems obvious, but avoiding non-traditional humor, keep it clean, keep it appropriate, avoid attacking as a group. If there's something going on, try and have that conversation with that one person one-on-one, or seeking support through somebody else that is trusted or that is respected, that you can also have that conversation if you feel like you need somebody else to be there. Already talked about not assuming, and follow up and clarify at the end of conversations. Summarizing is really, really helpful. So at the end you can say, this is really tough for me to bring up to you, but I just felt that it was important so that, we can work better together. How are you feeling about it? Because I feel better that we talked about it, and I really appreciate that you were open to doing that. But are you okay? And just saying something like that. And it really, when you're able to identify the difficult time you're having, or the struggles, your own limitations, it really helps the other person feel less defensive, because you're allowing yourself to be a little bit vulnerable in front of them. And that may take some time to work up to. Maybe you don't trust that other person, you don't want to be vulnerable with them. So maybe you could say, you know what, this is a really tough conversation for me. And that's all you need to say. But letting them understand where you're coming from too. So when you're communicating with somebody, it's not just what you're saying, how you're saying, but are you listening? Do you guys have any examples of when you were speaking to somebody and you just knew they weren't listening to you? What did that look like or sound like to you?
Just like typical guys, my husband, when there's a game on and I just something important to tell him, wait, it's a big play, it's a big game,
Right.
5 more minutes, wait till commercial.
So they're directly dismissive.
Yes, very, yeah. Yeah, or you can tell there's not focused, or even here sometimes. I mean, it happens everywhere. People's minds are somewhere else, and you know they're not really listening or paying attention.
What does it look like?
What do you mean? What does it look like?
When you feel like somebody's not listening to you, they're not hearing you, what do you see? How do you pick up on that?
They're not looking at you, they're
Blank.
drifting off,
Like a
and
blank.
like this, you know, and
Uh-huh.
you're here, but they're here, you know, that type of thing.
So you notice their body language
Yes.
a lot of times. And what are some things that you might hear?
And I have a bad habit, like.
Okay.
What's your bad habit?
I have a bad habit, if somebody's talking about something I really don't care to hear that thing, I'll take my phone and start playing on it and ignore them.
I appreciate
Now
that
we
you
know.
can acknowledge that and own up to it. Mike, it's a tough thing to do, but hey, you're aware of it,
Well,
so
we
you
have a
own
few
up to it.
chronic whiners in the lab about their families, this and that, it's like, I'm not hearing about it.
Mhm.
I'm on break.
Yeah. Well, and there's another way, like, oh, that must be really tough for you. I'm sorry to hear that, but there's counselors over there, and
Oh,
so.
I'll send them to you.
Yeah, redirecting them and redirecting a person and saying, that's really tough. And just acknowledging that you've heard them, but offering that you can go to them and talk to them, or, yeah, that's tough. So what are you doing this weekend? And changing the conversation even. But yeah, that can be tough because you're uncomfortable and you're like, I don't want to hear all of your personal stuff. So, I understand. I really appreciate that you're speaking up about it. But, so we can all see what inactive listening, when people aren't listening to us, what they're doing to us. So active listening, what does that look like? How do you know that somebody's listening to you?
They're looking at you.
Eye contact and they're kind of nodding, acknowledging.
And, this is actual fact that women can multitask and men compartmentalize. They have a very difficult time multitasking. So, women, we can be holding a baby, cooking dinner, and on the phone and still hear what our husband's saying to us. It's just a fact, all right? I'm just saying. But being aware that even though I may be able to manage it, that other person isn't aware of it. And so you need to afford them the simple respect to just look at them. Or, if you're at the computer and you're typing, just standing up for a second and turning and looking at them for just a second. And if you really don't have time, or you really are in the middle of something that needs all of your attention, just simply stating that, I really know this is important. Can you give me like 1 minute? Can I come talk to you as soon as I finish this? And just letting them know that this is, the boundary that you need to set. And if they can't, then just say, I really can't help you, let me finish this, or I'll help you find somebody else who can. And then again, redirecting them onto something else. So we kind of already talked about, so how do you actively listen? A lot of times it is limiting distractions, and sometimes it's a situational thing. Like I said, if this door were open, it would be so much louder in here, and walking through that area, it's hard to even hear somebody say hello to you. So I understand that in this actual workspace, the distractions are pretty significant. And being aware of that and understanding that, okay, if I can't hear you, you probably can't hear me. Or, if I haven't heard you before, you may not hear me. And just, again, being aware of those things. So reflective listening. So we talked about what it sounds like when somebody's listening. When you have a conversation with somebody, how does it feel at the end? Or what do they say at the end that helps you feel like they really understood and listened to you? Yeah, it's listed there.
They may paraphrase what you've said
Mm-hmm.
in the conversation.
Mm-hmm. Kind of like when you call and place an order for takeout, they repeat your order. It's the same thing. That's reflective listening. So even just, when somebody paraphrases it again, or they repeat back to you and they're like, okay, so just so we're clear, this is what you need, this is what you want. Or, a lot of times in counseling, it's also, wow, I can hear how tough that must be for you. If they're really angry and they're talking and I can see it in their face, I can hear it in their body, wow, you're really upset right now. I can see you're really having a tough time with this. When you can acknowledge their emotion, man, that takes the conversation to a whole new level. And the reason I bring that up is because I'm sure you have patients that come in that are anxious, angry. Maybe they've been here for 7 hours already. or, you know, whatever the case. Maybe they've been fasting and they need to eat. I know I get really crabby when I don't eat. So, you know, being aware that, oh, I know you must be really hungry. Okay, we're going to try and get you back here as soon as we can. So just acknowledging those things and acknowledging your own limitations, as I already said. Letting them know, I can't help you, but, you know, let me find somebody who can. Or I really can't take care of that right now. I'm sorry. Can we do it later? And whatever. And just acknowledging that. Or even, I really don't understand when you're asking me. Can you repeat it? Or, you know, I just don't know if we're going to get anywhere. So just acknowledging that can be huge. So some more tips about resolving conflict, improving the communication at hand. Again, practicing respect. I feel like we've really talked about that. And managing your emotions. You know, there was a woman that I worked with, not at the clinic. It was a job prior to when I came to the clinic. And she was just toxic. She was just a difficult person to work with. Every single day it was something. And if it wasn't the thing that she usually was upset about, it was the one thing that she typically isn't upset about. You know, our computers, you know, when you type in the wrong password, it beeps. If it beeped, whose computer's beeping? What's the problem? Yeah, and that's the reaction that you had, that's how it was. And so that's when I really ingrained the kill 'em with kindness motto into my brain. Because I said, you know what? There's nothing that she can do if I'm constantly kind and I'm taking ownership and I'm accepting responsibility. And so pretty soon she started calling me her little hell of sunshine. And I, every day, would come in and be like, hey, good morning. I'd say, good morning, everybody. And she's like, I didn't know there was sun in the forecast today. Every single day it was something. But you know what? I knew that I'm not going to stoop down to her level. This is her issue. I wonder what's going on with her. Mm-hmm. What is it like for her when she leaves work? What's it like for her when she gets to work? What is going on outside of her life that I see here? Because clearly it's not me. There's nothing I could be doing. So, and the reason I bring up that story is because there are just some people and you can't control them. It's out of your control. And again, it's not about you sometimes. So just realizing that, okay, how can I carry myself through this situation with integrity and respecting myself? And that, again, can help you get through a really tough situation feeling good about yourself. And I feel like a lot of times, at the end of the day, that's all we have, is how we carry ourselves, and is that we have ourselves. So, and being willing to back down, that's really, really key. Because sometimes it's like, okay, why am I digging my heels in? Is it because I just refuse to lose? Do I just not like this person and I don't want to give in to them? Do I not want to be around them? What is going on with me? And checking in with yourself. And it just takes a couple of seconds. I mean, it does take practice to get used to this self-talk, but it can be really, really effective. And sometimes just take a time out. Just say, you know what, we're going to need to talk about this later. The one thing that I tell a lot of couples that's actually really effective elsewhere is pick your battles. Is it really worth it? Is this really worth the stress that I'm experiencing right now? And again, I mean, a lot of things that I feel like I'm talking about, it starts up here. It starts with yourself, and it starts in your head, and just taking that second. That's why when you feel yourself getting stressed out, or you feel yourself in the middle of a difficult situation or conversation, taking that deep breath gives you a second to check in, and gives you a second to say, oh, okay, calm down. We can handle this. I can get through it. So just that positive self-talk. And when you're able to do these things, it really does make the workplace a lot more enjoyable. You know, I've had situations where people have just come to the understanding that we don't have to be friends. You know, on the engagement survey, I'm not going to put down that you're my best friend at work, and that's okay. But I still have to work with you, and we still have to be professional, and we ultimately have a job to do. So if we can still do our job, that's what's most important. I don't need to be your best friend, and that's okay. Don't show this to the engagement team. And it increases our ability to work more efficiently. Just as you brought up before, policies, procedures. When you can say, okay, I heard what you said, but I really need you to be more specific about that, or I need you to clarify. That decreases the risk of making a mistake, which can ultimately affect patient safety, which is very important to our job, obviously. And it just supports a much happier working culture. So, through the discussion, are you a little bit more aware of the communication process? Does it make more sense now? I mean, again, we all communicate, we all get it, but sometimes we forget that it's a lot more complicated than just simple talk. Do you feel as though some of the things that we talked about have given you new ways to maybe deal with it? Okay. And do you feel that you need further support, or do you have questions? Do you need clarification on anything that we've talked about today? No? Okay. Well, if you do need support in the future, or something does come up, you can call Concern. You know, we are just right over in the professional building. We're available. We have a lot of different counselors, and even if you don't want to stay here, maybe you want to get, you know, the heck out of Lakewood, get home or whatever. We have counselors other places, but you do have support. And even if you just need to come in for a couple of sessions and just say, how do I deal with this person? You know, I really need to work through this. That's fine. That's what it's there for. It is completely free and it is completely confidential. So thank you for sitting in with me today. I really appreciate your attention. I appreciate your active listening. I felt it and I really appreciate that. So have a great day. Thank you.
Thank you.